Hi, my name is Leo McCafferty, and I am a plastic surgeon here in Pittsburgh. We've been in practice for 26 years. And I would like to introduce to you Dr. Flavia Davit, my associate, who joined us just recently. She is really doubly trained. She initially was trained in Brazil, and a fully trained plastic surgeon there, met her husband, who was on a mission trip in Brazil, got married, and one thing led to another. She moved back to the United States and had to complete her training all over again, trained in general surgery, and then completed her plastic surgery training at the University of Pittsburgh several years ago. We're very fortunate to have her. She brings a real international component to our practice. Brazil, many of you may or may not know, is second probably only to the United States and in the number of plastic surgeons throughout the world, and also the number of contributions made to our specialty. So we're very fortunate to have Dr. Davit. She's an excellent surgeon and has an excellent way with patients.
And for me, it was a pleasure to join a very nice practice, that McCafferty practice. And my family, we chose Pittsburgh to raise our two kids and enjoy a long time here. So it was a very pleasure to join your practice.
You know, we talked a little bit about how plastic surgery is a little different in the United States than Brazil, and one thing Dr. Davit has told me is that the patient seems to be more involved in the decision-making here compared to Brazil.
Exactly, yeah. In Brazil, they are more like the weight, what the surgeons has to suggest. And here I think the patient are more, they want to participate more in their decisions, and we offer them all the possible options, and they're with us make their decision which options of treatment they would like to have.
So that puts a little more responsibility on us, and we also pass that responsibility on to the patient. But really, I think it's been a nice give and take,
Exactly,
at least
yeah.
in our practice.
I think being a plastic surgery, you kind of combine a little bit artistic and a little bit of humanitarian to deal with patients. So I think that is one of the very delight aspects of the specialty. I think one of the aspects that I like to have trained in a different country and come back and train in the United States, I could bring to the patients the good aspects of both cultures and both different kind of trainees, and I think that is a very unique point that I'd like to always that the patient has in mind, that that mix of two different kind of trainees add to, I think, to the options that I can offer to them.
And also I can chime in a little bit. She has a very comforting way with the patients, and patients, the feedback I get is that how comfortable they are with her, and how comfortable they are with her as they analyze problems or options.